What type of lenses are used in cataract surgery? How long does the surgery take, and what does the recovery period look like? Hello, I'm Christopher Scott, consultant ophthalmologist at Albyn Hospital, part of Circle Health Group. Today I'll be answering some of the most commonly asked questions about cataract surgery. I've been an eye specialist for 30 years and a hospital consultant for over 20, and I've performed this surgery thousands of times throughout my career. So if you're here for expert information, you're in the right place. Let's begin the video. Firstly, a cataract is a medical condition that affects the lens of your eye. The lens is a clear, flexible structure located behind the iris, which is the coloured part of the eye. It helps focus light, allowing you to see clearly. Having a cataract means the clear lens you were born with has become cloudy or opaque. This can happen very slowly over decades with age, or very rapidly with some drugs or trauma. The cloudiness can cause your vision to become blurry or hazy, making it difficult to see clearly. It can be like looking through a foggy or frosted window, or it can cause glare and dazzle in bright light. There are many types of vision problems that different types of cataract can cause. What causes cataracts? The most common cause of cataracts is simply getting older. As you age, the proteins in your lens can break down and clump together, causing cloudiness. Prolonged exposure to UV radiation from the sun can also increase the risk of cataracts. Wearing sunglasses that block UV rays can help reduce this risk. Smoking tobacco has been linked to an increased risk of cataracts, and people with diabetes are at a much higher risk of developing cataracts due to changes in blood sugar levels that can affect the lens. Trauma or injuries directly to your eye can also lead to cataracts, especially if your lens has become damaged. Taking some medicines such as steroids can also cause cataracts. How is a cataract diagnosed? In the UK, your optician will usually diagnose your cataract. Often they'll be able to help by prescribing new glasses, but you will need to be referred to a hospital eye specialist like me to discuss surgery. I start by finding out how your vision is affected by the cataracts. Next, I take your medical history, including your eye health and your overall general health, and what medicines you take. Some are relevant to the cause of cataract and can even influence how the surgery is performed. You'll undergo a vision test commonly known as the eye chart test. This test involves reading letters or symbols in an eye chart from a specific distance to assess your central vision. At the consultation, your pupils will usually be dilated using eye drops. This allows us to examine your lens and the retina at the back of your eye. I will use a slit lamp, which is a specialised microscope with a bright light, to examine your eye's structures as well as your lens. This allows me to assess the cataracts and look for any other conditions which might be relevant. In some cases, additional tests such as optical coherence tomography or ultrasound might be used to provide more detailed images of your eye's internal structures. Is surgery the only treatment for cataracts? Cataract surgery is the most common form of treatment because it's the only way to properly replace your lens with an artificial one, restoring your vision as a result. There are ways to treat cataracts in its early stages before surgery. For example, you might be prescribed new glasses or magnifying devices, but only surgery can eliminate the problem. How do you prepare for cataract surgery? We discuss many aspects of surgery beforehand, including the type of intraocular lens to replace your natural lens during surgery. You can choose between monofocal lenses, which provide clear vision at one distance, or multifocal lenses, which provide adequate vision at multiple distances. I might prescribe eye drops for you to use before surgery to reduce the risk of inflammation, and we'll discuss any other aspects of surgery that you want to know more about. We'll also discuss whether you want surgery in both eyes at the same time, or the surgery is separated by a few weeks. I can usually schedule surgery dates for you when you're in the clinic. You might need a general health assessment, including blood tests, to make sure you're fit enough for your surgery, especially if you're having a general anaesthetic. Typically, you'll be asked not to eat or drink anything for several hours before the surgery, but these details will be sent to you in writing before the operation. Since you'll not be able to drive home immediately afterwards, arrange for someone to drive you home. What happens during cataract surgery? Cataract surgery is typically performed using a technique called phacoemulsification. We make a tiny incision in your eye, often less than 3 mm in size. Through this incision, we insert an ultrasonic probe to gently liquidize and separate the cloudy lens into small pieces, which are then carefully suctioned out of your eye. After removing the cataract, we place the new artificial lens in exactly the same location where your natural lens used to be. This will remain in your eye permanently, helping to focus light properly onto your retina. This tiny incision is usually self-sealing and doesn't require stitches. It will heal on its own. What are the different types of lenses used during surgery? Here's a model example of a lens implant. A real implant was so tiny it would fit in my fingertip. Monofocal lenses are the most common type. They provide clear vision at a single focal distance, which is typically set for either distance or near vision. If you choose a monofocal lens for distance vision, you may still need reading glasses for close-up tasks. Multifocal lenses are also common. They're designed to provide reasonable vision at multiple distances, such as near, intermediate, and far. These lenses reduce the need for glasses or contact lenses after surgery, offering a broader range of vision, but they're not suitable for everyone. We'll discuss this in more detail at your consultation if necessary. Toric lenses are specifically designed to correct higher degrees of astigmatism, a common refractive error that can distort your vision. These lenses can correct both cataracts and astigmatism, reducing the need for glasses or contact lenses. However, they're only for people with moderate or high astigmatism. What does the cataract surgery recovery period look like? Most people can return home the same day of surgery. We give you post-operative eye drops and a protective eye shield before you go home. For some people, there's a very noticeable improvement in vision right after the surgery, even while still in theatre. Most people notice a big difference in the day or two after surgery. Colours may appear more vibrant and objects may seem clearer. While you may notice significant improvement right away, your vision will not be completely stable. It takes a few weeks for your vision to fully stabilise and adapt to the new lens. You usually visit your optician after a few weeks for an eye test and new glasses if you need them. When can you drive after cataract surgery? You should not drive until your vision is clear and you feel comfortable and confident in your ability to drive safely. This typically means that you can see well enough to read road signs, recognise hazards and have good depth perception. The UK law says that you must be able to read a car registration plate at 60 feet or 20 metres. When can you go back to work after cataract surgery? Many people can return to work within a few days after surgery, especially if you have a desk job or work that doesn't involve strenuous physical activity. If your job requires more physical exertion or exposure to dust or other potential irritants, you might need to take more time off to ensure your eye heals properly and to minimise the risk of complications. Some people experience minimal discomfort and clear vision almost immediately after surgery, while others may have temporary side effects such as blurred vision, light sensitivity, or discomfort that takes a bit longer to resolve. When can I exercise properly after surgery? In the first few days after cataract surgery, it's essential to rest and avoid any strenuous activities, including exercise. You should avoid very heavy lifting and activities that cause excessive straining, as these can increase the risk of complications. Most people can begin light to moderate physical activities such as walking, bowling or golfing 1 week after cataract surgery. Avoid activities that involve jumping or bouncing, as these can strain your eyes. By 3 to 4 weeks post-surgery, you can usually return to your regular exercise routine, including more strenuous activities like running, weightlifting and high-impact sports. Stay hydrated during exercise to help prevent dry eyes, which can be common after cataract surgery. So there you have it, a run-through of cataract surgery. If you'd like to discuss cataract surgery in more detail, you can book an appointment with me or your nearest consultant at circlehealthgroup.co.uk. We hope you found this video useful and don't hesitate to leave any questions in the comments section below.